All right, welcome everyone. So in this session, we're talking to Lisa Hendrickson-Jack. She talks about vaginas a lot. She's a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring overall health. In her new book, The Fifth Vital Sign, Lisa debunks the myth that regular ovulation is only important when you want children by recognizing the menstrual cycle as a vital sign. Drawing heavily from the current scientific literature, Lisa presents an evidence-based approach to fertility awareness and menstrual cycle optimization. She hosts the Fertility Friday podcast, a weekly radio show devoted to helping women connect to their fifth vital sign by uncovering the connection between menstrual cycle health, fertility, and overall health. With well over 1 million downloads, Fertility Friday is the #1 source for information about fertility awareness and menstrual cycle health, connecting women around the world with their cycles and their fertility. When she's not researching, writing, and interviewing health professionals, you'll find her spending time with her husband and her 2 sons. To learn more about her, visit fertilityfriday.com. But today, for this session, we have her here. So welcome, Lisa.
Thank you so much for having me.
Yeah, I'm really excited to get started with our conversation. So I wanted to ask you, how is it that the period can be a fifth vital sign? And what do you mean by that?
Well, that's a great question. I mean, a vital sign is essentially a bodily function that you can measure that gives us information. So the vital signs that we're most familiar with are like our blood pressure, our respiratory rate, our body temperature, things like that. And I think anybody knows that if you go to the doctor and they measure your blood pressure, uh, if it's too high or if it's too low, not only does it tell the doctor that there's a problem, but it also provides a bit of a roadmap because we know there's a certain, a few things that can cause high blood pressure versus low blood pressure or a fever, for example. And so, in the same way, the menstrual cycle can be used as a vital sign. And so, when I say the menstrual cycle, I'm not just referring to the period, as a lot of people would think. I'm referring to everything that happens. So, from the first day of your period, which would be the first day of true flow, all the way up until the next one. And so, just to kind of do a brief run through what happens there, your period starts, your menstrual cycle starts with your period. And then once your period finishes, you enter into your pre-ovulatory phase. And so as you approach ovulation, you would expect to produce some cervical fluid in a healthy cycle for about 2 to 7 days. And then once you ovulate, then you would expect the cervical fluid to dry up and your period would come about 12 to 14 days later. So if we kind of break down the cycle into those various parts and we start to look at when you should experience bleeding and when you shouldn't, when you should be seeing cervical fluid, when you shouldn't, how much you should be seeing, what it should look like, and also how long, the second half of the cycle should be, it gives us a lot of different parameters within the cycle that we can actually monitor health in different ways. And so just the same way we can monitor, overall health if there's something that goes wrong with one of your other vital signs, when you are a reproductive age woman, you should have a regular, relatively healthy menstrual cycle. And if that's not happening, it is a sign that there's something underlying that we need to be looking at.
So why don't more physicians use it as a vital sign or teach women about it?
Well, I mean, I suppose that there's a kind of like an easy answer and and a harder answer. And I would say, uh, first and foremost, that's not exactly how physicians are trained. So if we think about what is, traditional Western medicine or allopathic medicine, the phrase "a pill for every ill" basically describes it. So it's not to say that I'm putting it down necessarily, but we should really understand what our medical system is and what it does. And so with allopathic medicine, you're looking at symptoms and looking to suppress those symptoms. And if you think about it, when you have an issue, you go to the doctor and you expect to get a pill or something that's going to relieve your symptoms. Like if you have a headache, you take a Tylenol or, et cetera, et cetera. And so when it comes to the menstrual cycle, so I've interviewed a number of doctors because naturally I was curious, why are so many women having the experience where no matter what cycle issue they're having, whether it's irregular cycles, whether it's heavy periods or painful periods, whether it's, you could pretty much name anything that you experience related to your menstrual cycle. And, we all know that when you go to the doctor, the solution, it's like they have two options, it's the pill or painkillers, depending on your issue, and sometimes both. So, I've interviewed a number of doctors and basically asked, like, what are you taught in medical school? How does this work? And so this just comes from, what I've heard. And so my understanding is that in medical school, doctors are basically taught about the menstrual cycle, but essentially, if it falls out of any type of normal parameters, the solution that is presented and that they're educated about is basically birth control. And because it's an allopathic medical model, it's not part of the training to look under the kind of hood of the car, so to speak, and try to figure out why the cycles are irregular. So the best analogy I can give is, if you're going to McDonald's, you're not going to be upset if they don't give you an oil change while you're there, because that's not what they do there. And the hard thing for women who are really wanting to get those, underlying, they want to know what's really going on. They want that underlying cause of their period problems. Sometimes we have to go outside of the allopathic model to more of a functional medicine model to actually go to a practitioner who is trained to look at those underlying factors.
That makes a lot of sense. And in your book, you talk about the basal body temperature. How does that tell us about our health?
Well, I mean, the basal body temperature measure is a vital sign, as we already talked about, in its own right. So, when women are charting their cycles from a very practical standpoint, so a lot of women come to fertility awareness cycle charting. And so, for anyone who doesn't know what that is, it's essentially tracking your main fertile signs, which are your cervical fluid, your basal body temperature, and an optional cervical position sign. So, in terms of fertility awareness, it helps you to confirm ovulation. So it's fascinating from a scientific perspective that the different hormones that we produce in our menstrual cycle have an effect on our metabolic rate. And so essentially the basal body temperature is a measure of our baseline metabolism. So in the first half of your cycle, your ovaries are preparing for ovulation and they're making estrogen. And then once your estrogen reaches a certain peak, that triggers ovulation, and then you produce progesterone for the rest of your cycle. And so progesterone has a thermogenic effect on the body, meaning that it actually raises your metabolism and makes you warmer in a measurable way. So from that practical standpoint, then, when you're taking your temperature every day before you get out of bed and you're tracking it, on your app or your paper chart or whatever have you, you can't predict ovulation with the temperature, but you can confirm it, because once you've ovulated, your progesterone rises and then the temperature's high for the rest of the cycle. And so, if you're using it for birth control or conception, this is very helpful information. But your question was, how does the temperature tell us information about our health? So, other than just telling us about ovulation, it is a measure of metabolism. And so there is a such thing as a normal temperature range. So a lot of women find that when they start taking their temperatures every day, that it's not falling in the range. And I think the most common kind of aberration you could say is the temperature being too low. And so as an educator, the first thing I want to do is make sure she's taking her temperature correctly. And, we don't have, I've had a client whose, temperature was really high all the time. And, I was like, before we go down this road of like possible infections, can we just get a new thermometer and see if that's the problem? And that fixed it right up. So it was actually a thermometer issue. So anyways, all kind of jokes aside, it's really helpful in that respect because it is this measure of metabolism. And there are plenty of functional health practitioners, for instance, Chinese, traditional Chinese medicine practitioners who already use the temperature as a vital sign and a measure in their existing practice.
That's incredible. And I really loved your book because it presents a lot of research on the menstrual cycle. And I wanted to ask you, for somebody who is perhaps experiencing painful periods, what is that indicative of and what can they do?
Well, that's such an important question. And the first thing I want to say is that, it's pretty common for women to have pain. A lot of women have some degree of pain with their periods, ranging from mild, where it's not that big of a deal. They don't necessarily have to take medication, to moderate, to severe. And it's a fairly large number, fairly large percentage. And because of that, because it's so common, we tend to think that that means it's normal and expected or acceptable. And so to start this part, to start my answer, I want to just put it out there. There's no other situation other than childbirth where we can actually say that pain is like expected. So if you think for a moment of any man in your life who just imagine if he had moderate to severe pain in his penis for a couple of days every month that rendered him, incapable of walking and working for either a couple of hours or like a day or two, no one would think that's okay. So I think the first thing we have to do is acknowledge that pain is many professionals call pain a vital sign, kind of like the other vital sign. And you can kind of look that up. It's interesting. And so pain is a sign of a problem. Outside of childbirth, anytime that you experience moderate to severe pain, we're quite clear on the fact that that's not okay. So your question, was what could it signify? And so this is one of the reasons I present so much research, in the book and in the work that I do, because as women, there's a long history of being gaslighted, not taken seriously in medicine. And there's a specific history regarding period pain for women to not even be taken seriously at all, for health professionals to basically say, no, that's impossible for it to hurt like that. So a couple things. There was one research study that I looked at that measured an inflammatory marker, called prostaglandins. And so those are lipids that cause smooth muscle contractions. So in order for you to have a period is a natural inflammatory process. And so we have to produce some of those prostaglandins to actually cause those smooth muscle contractions to help, to get the blood out. That's part of the process. And to understand the period as a normal inflammatory process, similar to ovulation, which is also a normal inflammatory process, then it makes a lot of sense that if something goes awry or if you have too much inflammation, that could potentially be a problem. So when they measured the inflammatory markers, in the women that had reported, moderate to severe pain versus the women who didn't report pain, the women with the moderate to severe pain reported, or when they tested the prostaglandin levels, they had, upwards of 4 times the level. So there you have, and I think this is helpful because it's data. We're in an age where we want the science, right? So this means that it's not in your head. It means that women with pain have actually, significantly higher inflammatory markers in blood draws. And I recently found a really interesting paper that somehow the researchers were measuring the pressure, so the actual pressure level of the contraction. So if anyone's experienced period pain, it feels like contraction. So I personally experienced ridiculous pain when I was in my teens and early 20s before I kind of figured out what to do. And it was ridiculous. So I'd be on the floor. And I remember saying once, it feels like I'm in labor, but I didn't have a baby out of the deal. Like, right. And then I went on to have 2 children, and labor was actually more manageable. So literally, so for anyone who hasn't, been in labor, I'm not saying it was like a cakewalk, but I'm saying that with the labor, there were actually contractions and then a pause and then contractions and a pause, and they were for a purpose because I was having a baby. And so, and so,
Yeah.
it was actually manageable compared to the period pain, which is just all day long. And it just, anyways. So my point is I found this paper and they measured the strength of the pressure of the contractions. And lo and behold, women who experienced, severe, moderate to severe period pain, the pressure was significantly higher than the women in labor. Like it was, I couldn't even, and it was so interesting because when I was actually really pissed off that day when I found it, because the researchers basically concluded that, oh, wow, women have been saying this for a long time, that they have experienced period pain to be worse than labor. And it turns out there may be something to that sentiment. Like they didn't even, officially say, wow, this is the proof that all these women have been telling them. Anyways, so all of this is to say that it's real. It's not in your head. Like this is literally, like, it's sad that we have to dig up research to verify what we experience, but this is where we're at. So for anyone who's listening and who's experienced intense pain, it's not in your head, and we have the research to show that it's not in your head. So then what can we do about it? So understanding that periods are a part of a natural inflammatory process, and women who experience them have higher levels of inflammation. And of course, there are other reasons why you may experience significant pain. Endometriosis is one of certainly the causes of a lot of pain as well. So, I go into it in a lot more depth because I know everyone kind of wants, like, well, what do I take and what's the supplement? And so it's kind of like a process where you want to identify where your sources of inflammation are. And so some of the most common sources would be, the sugar. We eat pretty like a high, simple sugar kind of diet, generally speaking, as a culture, which is a source of inflammation. I'm not anti-dairy, but conventional dairy products are made with milk that comes from cows that produce a protein called A1 protein. So that's something to look into more. So there are some women who switch to, say, goat or sheep's dairy, so I know way too much about like cows and milk and stuff, but there's Guernsey and Jersey cows produce A2 milk, and it's becoming easier to find because it's a thing. And so if you have like a Whole Foods near you or a place where you can buy milk, you can sometimes actually find A2 cow's milk. But my point is that for women who are consuming, dairy products, you may want to look at switching to the A2 versus the A1, the goats or sheep dairy, or look for A2 cow dairy. And women, just by doing that, a lot of women experience significant relief. And then there's the oils, like I call them industrial seed oils. The media calls them vegetable oils, but they come from seeds. So really starting to look at the sources of inflammation. And then once you start removing the inflammatory factors, you can look at incorporating more of the like omega-3 fatty acids that are anti-inflammatory. So, eating more fish, looking at incorporating things like that. And then in addition, becoming more aware of some of the nutrients that are known to reduce inflammation. And so, I have a chapter on period pain. And in that chapter, I go through a lot of what we talked about today. So explaining how the period works and all those things. And then I go through some of the research behind why magnesium and zinc and fish oil and other nutrients have been associated with reducing inflammation in women. So the good news is that there's a lot you can do to reduce your pain. And it's not something that it's magical. It's not something like you take, magnesium one day and it's all great the next. But certainly I have had a lot of success with my clients reducing pain. And I have never met a woman who, if I ask her to gauge her pain, like from 0 to 10, and she's at like a 10, if it goes down to like a 6, I've never had, in, the first couple cycles, I've never had someone be like, oh, most of these women don't even necessarily talk about the pain because they've kind of accepted it. And so they're not even expecting to get rid of the pain. They just think it's going to be like that forever.
And speaking of nutrients, what are some common nutrient deficiencies you've noticed in either the literature or with your clients who've experienced the most excruciating pain, like the most pain? And that's pretty common across the board.
Well, I mean, certainly you could argue that pain in of itself could be a sign of a deficiency of magnesium. And so I wouldn't say that I've extensively looked specifically at what nutrients women are deficient in, but I would say that, any woman who experiences really, really severe pain could definitely benefit from magnesium.
Mhm.
I interviewed a woman named Dr. Carolyn Dean, and she wrote a book called The Magnesium Miracle, and that's an eye opener. I mean, you can certainly dive into the research on basically any nutrient there's even studies that show links between low vitamin D and, period pain. So certainly it's worthwhile to have a kind of a holistic look at your overall nutrient profile. But certainly for period pain specifically, I'm usually looking at, again, how can we reduce what we're doing, reduce the inflammatory foods and different things that we're putting in our body, increase the foods that reduce the inflammation, and then look at some of the different nutrient supplements. And one other thing I can mention is that, we don't necessarily think about, pain and things like that from a physical perspective. So for women who do have endometriosis, it's characterized by endometrial tissue that should be growing on the inside of the uterus, growing in other places. So it's, kind of like a dysregulation of our normal function and even our immune function. And that can lead to what they refer to as, lesions. Um, there's another word that I'm thinking of, but essentially you can have where instead of your uterus having normal movement and motion, so your uterus does move, and it should actually move a bit freely. So it even changes position throughout your cycle in relation to estrogen, progesterone. So if there's a lesion or something that is preventing that free motion, that can also contribute pain. So sometimes the pain can be a physical thing. And so, I've interviewed a number of our Vigo professionals, Mercier therapists. There was a woman I interviewed who does fertility massage therapy, and a couple that I forget exactly what it was called, but it's essentially abdominal therapy modalities where you actually go have someone actually work on you, meaning that they do a deep kind of tissue massage in the area, the abdominal cavity, to break up adhesions. So to kind of, if you have areas where you don't have the movement that you should have and things like that. And so there are women who experience relief of pain and even improve fertility when they do it kind of from a physical standpoint. Because when you, for example, if you did have endometriosis, the only way to diagnose it that I'm aware of currently is through a laparoscopic procedure. So they literally have to go in, to your body surgically and check. And also that is what medicine offers to kind of improve, because they go in and they kind of cut some of that tissue and move it around, things like that. So it's just, I think with this issue, the more like the more education that you have, because for many women opting for an abdominal massage therapy modality that's specific to this issue. So it's not like you're on the beach having someone rub your back, right? Like it's someone who's aligning the uterus, making sure that it has freedom of motion. So it's definitely like a process, but it's much less invasive than surgery. And so for many women, they might not even know that that could potentially be a first step in before you kind of move. Like surgery is always an option, but for many women, it's, a lot of us don't necessarily want that to be the first thing we do. So to have these other options is really helpful.
That does sound helpful. And for somebody who's interested in learning more about fertility and awareness, what does it look like? And does it really work for conception and birth control?
Um, so what it really looks like, I suppose, I mean, ultimately, you need to learn, you need to understand what you're doing. And so the first aspect of charting would be to educate yourself. So there's a number of books. There's my book. There's Tony Weschler's Taking Charge of Your Fertility, which is one of the most common resources for women. It's a lot where I found where that was my first resource when I was learning as well. So there's a lot of information out there. So the first step is educating yourself on how this works, what's happening from a scientific basis, so you can kind of wrap your head around it. So, and there's a lot of myths that are still out there. So most women haven't necessarily heard, unless they've kind of fallen into the fertility awareness rabbit hole, that you're not fertile every single day like you were taught in junior high. There's only a small window of fertility that lasts about 6 days. So, because the sperm can survive in your cervical fluid up to 5 days and ovulation happens on one day. And so, no, you can ovulate, twice in your cycle. There's one day that ovulation has. So there's all these myths that if you can wrap your head around the actual science behind it and know that it's not the rhythm method, it's not the same. It's not about, predicting when you're going to ovulate. It's about understanding how to tell if you're fertile every day versus when you're not. So that would be the first step. And when you're using the method for birth control, I do recommend that you consider working with somebody who's certified and trained in a specific method of fertility awareness charting. So it's not to say that it's impossible to do it on your own, but I'm a bit biased. So when I first learned, I certainly was, my magical university campus, there was a group of women, some of whom were certified instructors, and some of the women were training to be instructors. So I actually received high level proper training from women who were certified. And then I went on to, take a class and teach and become certified myself. And so what I can tell you is that it potentially, 30 years ago, when, most women weren't necessarily on the pill for, an average of like 5, 10, 15 years, it might have been a bit easier. Like there's things that come up. So for example, when you read books about charting, they tell you what what a normal cycle looks like. So a normal cycle is an average of about 29 days. You have mucus during your fertile window before you approach ovulation. Like everything just kind of moves along just fine. But these days, a lot of women don't necessarily have cycles like that, especially if they're coming off the pill to chart. They may have cycles with no mucus, mucus all the time, irregular patterns, delayed ovulation. And so you can chart successfully and use the method as birth control through all of those challenges. But uh, I think the bigger challenge is that when your cycle doesn't fall in the normal range, you kind of get freaked out. You kind of need that additional support. So I guess all I'm saying is it can be a little bit more challenging. Um, and support, I, of course, as an educator, I'm going to look at things differently, but I think that if you wanted to use it for birth control, so, fertility awareness, when used correctly, the symptothermal method, meaning a combination of the temperature and the mucus signs, and the cervical position sign, has been shown to be upwards of 99.4% effective when used correctly, putting it in line with hormonal contraceptives. So, but in those studies, the women who were using the method correctly were trained by educators. So, so it can certainly work. And you asked also if it can work for conception. And so, because we don't learn about how our cycles work, there's also a lot of myths around, ovulation is always on day 14 and you should just have sex on day 14, or you should have sex every other day, or all those kinds of things. And so there are women who have sex based on whatever date they think that ovulation is happening on. And if their cycle doesn't really match that, it certainly doesn't help. So fertility awareness can help you time sex correctly to make sure you're kind of hitting the right days. But also, if you do have certain issues with your cycle, if you have different hormonal things that are out of whack, you'll see that when you're charting. And so, if you're not actively charting, there are things that you wouldn't know that were happening. Like if you had, so the second half of your cycle, I had mentioned, so between ovulation and your next period should be about 12 to 14 days in a healthy cycle. And if you're charting and you're confirming when you ovulate and you notice that the second half of your cycle is only 8 days long, you wouldn't necessarily know that if you weren't charting, and that can actually make it harder to conceive. So there's certain things where you can identify them on the chart, and that can be helpful. And I would put on the flip side as well. If a woman is trying to conceive and it's not happening, of course she blames herself and thinks it's got to be her, because that's how our culture works, right? So if you're charting and you actually see that your charts are perfectly healthy and fine, that might motivate you to get your partner's sperm checked out so that we can make sure that we're like, because then we can't keep saying it's all me if my cycles actually look great.
For sure. That seems really helpful. And it seems like knowledge that would be really useful at any stage in a woman's life or a menstruating person's life. Um, so before we wrap up, I wanted to ask you, where can people find, the resources you provide, the courses, the book, if they'd like to look into it more?
Well, thanks for that. So, I mean, the book is available on Amazon. It's paperback, ebook, audiobook. And, as you mentioned, I made a point of going a little nuts with the citations. So there's like 40 pages of notes in the back with, peer-reviewed studies and all that. And again, the reason for that, fertility awareness is still not necessarily a mainstream thing. It's certainly a lot more well-known today than it was even 20 years ago. It's wild. From when I started in this area, but still it's not. So a lot of women still have the experience of, going to their OB and, I'm coming off the pill and I'm going to chart my cycles, and the OB literally laughs at them. So having the resources can be really helpful. You can get the first chapter for free if you want over at thefifthvitalsignbook.com. And I mean, if this conversation was interesting to you and you're wanting to learn more, I think the podcast, so the Fertility Friday podcast, I've been doing that for the past 6 years or so, maybe a little more. And so just type Fertility Friday in your favorite podcast player and you'll find me there. And you'll find more about me on fertilityfriday.com. So I'm around, and I'm on Instagram. That's probably where I'm most active currently on social media, at Fertility Friday. So lots of just lots of resources. Most of it is like obviously free and just available. And And yeah, I mean, ultimately, I think that all women have the right to know what's happening in their bodies. And if we just wait until the education system decides that it's important, we're just going to keep waiting. So it's kind of up to us to spread this information around so that we can have it.
Absolutely. Well, thank you so much for joining us today. And yeah, for those of you watching, please check out the links we're going to provide below and stay tuned for the next session.